Hello, I'm Lisa Karsrud, owner of Absolute PCA, and we're here today with Darla Johnson, the Director of Nursing for the Leech Lake Tribal Health. So she's going to be a wonderful resource for us because you are Native American and you work in the health industry as well. So we're going to ask you a few questions so that our PCAs can learn more about cultural competency and the best way to work with Native American clients that we serve.
Okay.
Tell us, what does cultural competency mean to you?
To me, it means to understand, acknowledge, and respect the beliefs, values, and traditions of our culture. For Native Americans, we really value our traditional like ceremonies, medicines, and recognizing the importance of family, community, and spirituality in healthcare decision making.
Perfect. What would you say are some misconceptions or stereotypes that you've encountered regarding the Native culture in care settings?
Well, I'm going to give you an example. So like smudging, that's, burning of sweetgrass and stuff, that's part of our medicinal value, tradition, ceremonial thing. From my experience, we've asked, different, like say hospitals or nursing homes or anywhere like that, if we could smudge, and they wouldn't allow it because they didn't understand it.
Sure.
So like Bemidji Sanford has actually been improving on their policies in regards to traditional ceremonies and whatnot in the hospital setting. So
yeah, because that's a really big thing for your culture.
It really is. Yeah.
Can you share some experiences with caregivers or healthcare professionals where your cultural values and traditions were acknowledged and respected?
Like, let's say, back to like Sanford and Bemidji, they started to realize how we valued our traditions and culture, so allowing us to smudge the sweetgrass and whatnot and patients' rooms. So
yeah, and for like a home care worker working with someone, they might encounter someone who's burning sage in their house, and I think to be respectful of that culture, like just let them do their thing. Don't interfere with that probably, or necessarily. Is that something that a client might want them to help them with, or?
They may ask you that, but after they're done doing their smudging and whatnot, I would tell the staff, maybe ask about it, if they don't understand what they're doing. They're really, really willing to explain our cultural side and aspects of it. So
perfect. I think maybe sometimes people aren't sure if it's okay to ask or not, but it's a lot of really neat things to learn by asking. How can PCAs better understand and respect cultural practices, like maybe dietary or language or family involvement?
I really think it's the communication aspect of it, is communicate with your patient, their family, ask them questions if they're, what kind of dietary, like they may be making fried bread or wild rice, and there's wild rice dishes and stuff like that. Research the Ojibwe culture and traditions. There's so much out there on that. I really, so some of my nurses here, like even in home care, some know our traditions, some don't. So then, we have a civics class they attend, and it explains, the Leech Lake Ojibwe reservation and culture and traditions in that aspect. So
nice. That's wonderful. Are there specific cultural practices or values that you feel should be prioritized or better understood in caregiving?
So I jotted down the 7 grandfather teachings, or the 7 sacred teachings, as a Ojibwe go by. I think it's a set of guidelines for living a good life based on principles.
Perfect.
So there's wisdom. It's using good judgment and common sense to make decisions. Love, practicing kindness and compassion for oneself and others. Respect, treating all living things with honor and care. Bravery, having the courage to stand up for what is right and overcome challenges. Then we have honesty, being truthful in all dealings and living in integrity. Humility, recognizing that no one is more important than another and that all life is interconnected. And then truth, living in accordance with reality and natural laws of the universe.
That is wonderful.
Yeah, that's
Beautiful.
What a lot of people, live by here on the reservation and even off the reservation in our
Yeah.
Ojibwe culture. So
Perfect.
yeah.
And I think too, an important thing, as we kind of talked about, is it's okay to ask about
Yep.
your culture and
Mhm.
ask, how do you want me to do this, or is this okay? I worked in home care years ago in the Deer River area, and there was an elderly Native man I worked with, and I loved to see him because I would sit there and just chat with him about the
Yes,
culture.
they like
And he
to.
loved to share
Yeah.
everything. It was
Yeah.
wonderful.
They do. They really love to share, and that's, I feel, is a big thing, is listening to your patients.
Yep.
Taking the time to do it, because if you don't, maybe they start having some kind of behaviors, and
Mhm.
it's that whole trust, that you need with your patients. So
Trust is a big thing.
Yeah. Yeah.
What's the best way to earn trust?
To listen.
Yeah, just
Mhm.
listen.
Yeah.
Communicate and listen.
Yep.
Perfect.
Mhm.
Do you have anything else to add?
I think by demonstrating cultural competency for healthcare providers can better build trust, improve patient satisfaction, and ultimately achieve better health outcomes for Native American patients.
Wonderful,
Mhm.
for sure. Thank you so much for being with
Yes.
us. I know you're very busy, being a director of nursing and wearing many hats.
Yes.
So we really appreciate it so
Yes.
much.
Thank you. Thank you, guys.
All right.